Hello, everyone. My name is Gorher, and I am here joined by Toyosi and Beate, two researchers who are working in Photovoice methods. And instead of speaking too much, I will let themselves introduce each other.
Hi, Gara and Beate. My name is Toyosi Adekeye. I'm a research optic manager for the Light Consortium at the Zanklin Research Center in Nigeria, where I manage the research activities and research products across the Nigerian consortium. Thanks.
Hi, I'm Beate Ringwald. I'm a postdoctoral research associate with the Liverpool School of Tropical Medicine. I'm also working for the Light Consortium, and I'm based in Uganda, and I'm supporting participatory and social science research across all partner countries. Light is a consortium led by the Liverpool School of Tropical Medicine, working with partners in Kenya, Uganda, Malawi, and Nigeria. Today we hear from our Photovoice project in Nigeria. And we're exploring gender pathways for people with TB in urban settings in these 4 countries. And we hope to improve access to TB care and reduce mortality in these countries.
And so we'll jump right into our questions. My first question is, what inspired the use of Photovoice methods in TB? And what gaps in our understanding of tuberculosis do you believe are filled by the use of this Photovoice method?
I'm motivated by my doctoral research. It was not on TB, but I worked with people from an informal urban settlement in Nairobi in Kenya, and they were lay researchers in our research team. They often used metaphors and stories to share knowledge and their experiences. And I think we underutilize this kind of communication and knowledge in our research, and Photovoice is because we use photos and captions that capture experiences and views of people affected by tuberculosis in our case. And that's a method that really builds on this storytelling idea.
Absolutely. I think I'll just piggyback off what Beate just said. The Photovoice methodology is an interesting and quite a unique type of methodology. And importantly, it's new in our target communities. As such, my inspiration to use this methodology is to keep our participants fully engaged and empowered to actively kind of express their thoughts and opinions about certain things that are guided by our research questions. It's quite different from what the communities have been involved with in the past, because TB research is not new in the communities that we work in, but most of them have worked with surveys, questionnaires, and then, other qualitative methods. But this provides an opportunity for them to provide some nuanced information on TB based on our objectives. Thank you.
Hey, thank you. So you mentioned nuances. Well, what kind of nuances do you think, like, you could give an example? Like, what have been the findings of your research work thus far? So we'll start off with just that.
Sure. There are some, we're still in the data analysis phase, so we only have some preliminary data that we can work with. But I've been excited with some of the photos I have seen. They have kind of brought out some issues that have not previously been well researched into. One of those things I think came out of it was not necessarily stigmatization, but kind of like isolation that is related to tuberculosis. Like when someone in a family of, say, 5 is infected with tuberculosis, they have to eat away from the family. They have to spend time alone in their rooms. And some of those pictures kind of expressed how, especially when it entails the younger people, the young ones, how difficult it can be for them to cope with some of those issues of isolation and separation from family. So that it kind of affects their social lives alongside the issues that accompany tuberculosis. I think when we complete our data analysis, we're going to have a clearer picture of some of these very nuanced issues that have been brought out.
Yes, I'd like to take us back to our preparation for Photovoice. So we started off with a training for researchers, both within the Sankey Research Center, but also more broadly at Bingham University, where Toyosi is based, to promote the idea of this methodology of Photovoice. And we did it both in theoretical and practical ways. So we did a mini Photovoice project with researchers who took pictures. It had nothing to do with tuberculosis, but putting ourselves into the shoes of participants, taking photos, sharing intimate experiences was very important for us as researchers to get a grip of Photovoice. And then we also, before we embarked on asking people affected or living with tuberculosis to take pictures and share their stories and experiences with us and with the community, we first held a meeting with stakeholders. So we invited policymakers and healthcare workers, people who work in the national or state TV programs. And we expected a bit of a backlash, I think, about the method, but to the contrary, everyone was very excited. Although Photovoice is not primarily a data collection method, it's about stimulating dialogue and change within communities and health facilities. And everyone was quite enthusiastic. So we hope that both the story listening and the storytelling will come together when we do the dissemination, and that policymakers and healthcare managers will truly listen to the stories that participants will share.
Okay, well, I really appreciate you sharing that. I'm a little curious about the backlash you expected. Was it because of sharing about tuberculosis specifically? Did it have something to do with the method, if you're able to speak to that?
I think backlash in two ways. One is whether Photovoice is truly a scientific method, or whether it's not an advocacy or an arts-based project, whether we can consider this research. So that, I think, was one fear. And the other one had to do with it being a tool for change, not just documenting a situation, but actually then engaging in a dialogue that will lead to change and for improvements for people affected and living with TB. So we are yet on this journey and hope we'll make some progress there.
Perfect. And so my next question is relating to, although you've touched on it a little bit, have there been any surprises along the way in the process? I know you're still like it's not in the final stage, but versus what you expected to find versus what it seems to be you're finding. Toyosi, I wonder if you can speak to this.
I don't think there were surprises. I think there were more of learning opportunities for us. We had we're working with two communities, and they're the ways apart as far as distance. And one of the things we tried to do in our planning phase was to coordinate these two communities to participate in our training workshop, in our initial workshops, and the final data analysis workshops together. By giving them advance notice and things like that. But later on, we were quick to find out that because they had different clinic days for TB care and services and different engagements across the two communities, it was practically impossible to get both communities or participants from both communities in the same room at the same time. So we had to quickly, move things around and kind of target the communities separately. I think that was one learning opportunity for us to just not make assumptions and to actually plan with a level of flexibility. Keep in mind that while we were planning for this project, the community members were part of the planning process. So even they were surprised that things didn't work out as planned. I think another challenge or a learning opportunity that popped up during this project is something we had not maybe thought through as much. For female participants, they were very eager to participate. They gave their consent to participate. What we did not put into consideration was the support of their male spouses. Yeah, so we had a couple of participants who did not get the support they thought they'll get from their spouses. And one of them actually had to drop out of the study. So, moving forward, that's something we have to think about. Maybe during our initial sessions where we're telling them about the program, just before we get the consent, when we invite the female participants, we should as well invite their spouses, just so that, it'll be a collaborative thing.
Yeah, I think one surprise for me was how long it took us to plan this study. We had to think a lot. So we knew we wanted to do Photovoice to get ideas for how TB care and prevention can be improved in more gendered ways that meets the needs of women and men. But it took us long to plan it because I can just give two examples. One is we thought long about recruitment process, how that could be meaningful but also practical. So avoiding drawbacks from convenience sampling on one side, but also mitigating against unintentional disclosure of tuberculosis among participants, towards us researchers or also towards the community. To make the process voluntary, because we recruited participants through health facilities, so we wanted to avoid coercion. And the other thing is, so what cameras do we use, and what does it mean for participants to get these cameras? Is that a risk to their safety if they have these cameras for a couple of weeks to take photos? And then also, what does it mean to them to have to give the cameras back? So yeah, these are just initial thoughts we had to get our heads around to plan the study.
Some considerations that might not be obvious for sure. So thank you for sharing them. My next question, I feel like we've already touched quite a bit on it, but if there's any additional challenges or let's say drawbacks your team has encountered, like maybe specifically related to method in general or specific to the study you conducted.
Yes, I think Photovoice is a very unique methodology. It's a little different from the traditional type of research that most researchers are familiar with. And for those who might be participating in a Photovoice project, my thought is practice. A lot of practice must be put into it. You have to truly understand the methodology. And for us here in Nigeria, what we did was when we put together our team, we had a practice session by conducting a pilot Photovoice study. And that gave everybody an opportunity to actually participate in the project. This is after learning the theoretical aspects of it and then during the training. And then we now went into the field and had a pilot Photovoice study, which kind of gave everybody a hands-on experience on how to conduct Photovoice. I thought that was really helpful because when it came to the current study we're working on, we were able to execute it, effortlessly. I think another thing people should think about when they're trying to participate in Photovoice is to think about ways in which they can disseminate their results. So the methodology is such that it can be tailored to a very diverse group of audiences. And so you can have peer-reviewed publications, you can have slideshows at events, you can have just a variety of ways in which it can be disseminated. I think we can be very ingenious in the way we think about those. We can get the message of whatever Photovoice projects we do out there.
Photovoice might come across as a data collection method because you get this, you get pictures, you get captions, both of which can be very catchy, but it is the vehicle to engage in change and dialogue. So really what comes after that, that people affected by the problem get to tell their stories through the photos and have people listen to them, and as a way to make change in their communities. I think that's an important thing. I hope we get to with this project, and I hope others will adopt. Thank you.